Hello, Senator Van Hollen. How are you, sir?
Hi, Gary. I'm good. Good to be with you.
Let me start this conversation today with a quote from an article that was written by Aaron David Miller, a former colleague of mine at Woodrow Wilson Center, who penned an article on how the events of the last few months connects to past historical events and can inform our expectations around our future. So let me start off with that quote. Quote, looking at the events in the past several months, one is tempted to recall Dr. Martin Luther King's notion of the fierce urgency of now, a phrase intended to convey his impatience and frustration with the caution of the liberal establishment on what would soon become the historic 1964 Civil Rights Act. Indeed, rarely in American history has there seemed to be a moment filled with more urgency and promise of change. That urgency has given even more intensity by a trifecta of crises affecting the nation and with an eerie echo of past events that have carried profound consequences for this nation. And it goes without saying, these crises have disproportionately brought grievous consequences to communities of color. Senator, the trifecta that Miller is referring to is COVID-19, the planet's most devastating pandemic since 1916 through 18 Spanish flu. The economic collapse of a magnitude not seen since the 1926 Great Depression. And Black Lives Matter, the most significant civil rights movement since the 1960s, all occurring simultaneously. Senator, what's your immediate reaction to that statement?
Well, Gary, first, let me just say thank you for bringing us together in this forum. Thank you for all you've done throughout your different careers to fight for social justice. And thank you for what you're doing now at the Center for Workforce Inclusion. I do want to recognize some of the people who I understand may be on the call who I've worked with on social justice issues here in Maryland, including Reverend Dr. Stephen Tucker of the National Capital Convention of DC, Baptist Convention, and Bishop Walter Thomas, who's the senior pastor at New Psalmist Baptist Church of Baltimore, and a number of others. I know you have a big group here. And I agree with the quote you just cited from Aaron David Miller. I think that trifecta of issues has brought us to a moment of reckoning in the United States of America. So let me just start with COVID-19, which has had devastating consequences, but they've been made much worse because of the neglect we've seen from this administration, failure to follow advice from healthcare and public health experts in the United States. And as a result, we've seen more people die than had to, and more people out of work than would have been otherwise. So at this point, we've got to make sure we tackle this issue. And as you point out, it has brought with it deep exposure of disparities, healthcare disparities. This disease has disproportionately hit communities of color, and the economic fallout has been borne disproportionately by communities of color. And I know we will address those issues as we continue this conversation. The HEROES Act was passed by the House of Representatives more than 5 months ago. And we can, if people are interested, go through the different elements. But let me just say, it's a comprehensive response to both the healthcare challenges from the pandemic and the economic fallout that's being experienced. And sadly, that has not come up for a vote in the United States Senate. The House passed a round 2 of it, which also would be a major step forward, but that has not yet come to a vote. On the issue of Black Lives Matter and the reckoning we've seen as a result of the police killings around the country and injustices we've seen, that also needs to be tackled. And as you point out, this is a moment where we've seen activity, peaceful protests, people demanding change, and we need to bring that change into the United States Senate and House and White House. This is another area where the House passed the George Floyd Justice and Policing Act. That's an urgent matter, in my view, and we need to pass it, but that's not enough. I've also introduced, along with Congresswoman Karen Bass, who's the head of the Congressional Black Caucus,
Yes.
a bill called the Community-Based Response Act. And this gets at the other part. The Justice and Policing Act will bring more accountability to our police, but I believe we need to restructure how we respond to so many of these emergency situations. And we just saw this terrible killing in Philadelphia just the other day. We've seen so many cases where we really need not a police and law enforcement response, but a response that addresses mental health crises, housing crises, substance abuse crises. And so our legislation would use federal dollars to encourage state and local governments to move in a direction to develop alternative responses where that's more appropriate. And finally, you mentioned these very deep economic issues. And the pandemic has laid bare, again, these inequities in our economy. We need to address this urgently, not just to help those who are hurting economically because of this crisis. The HEROES Act would do a lot of that. But we need to take bold action as a country to begin to develop an economy that does truly work for everybody. And that means jobs available, living wages, ability to build wealth and close the wealth gap, and have things like affordable housing and childcare to support our workers and families. So these are the three urgent issues of our day. I do think we're at a moment of reckoning, and I think the elections will determine what path we take.
Thank you, Senator. You've offered a lot there in your opening statement. I want to drill down a little bit by starting off with COVID-19 and the vulnerability that it has created across our nation, but in particular within Black and Brown communities, and in particular with respect to our aging population. As you know, in Maryland, African Americans make up 30% of our state population, but we are also 34% of the COVID-19 cases. We're also 40% of the deaths that have occurred because of COVID-19. So there is an obvious disparity there in affection and fatalities specific to a singular community. What is your response to that?
Well, my response is, number one, we need to close these gaps, and that's going to be a question of addressing a whole range of things that makes communities of color and the Black community more vulnerable in the first place. And in the immediate term, that means making sure that we channel the resources where they're most needed. I will say that early in this pandemic, I organized a letter from the Maryland congressional delegation to Governor Hogan, urging the state to collect the data and break it down based on race and ethnicity and zip code. And I'm glad they did it, because that's why we now have those numbers available to us. But the reason for gathering that data is not just to have it available. It should inform our response. And that means that our healthcare response, when it comes to things like deployment of testing and contact tracing, we need to make sure that those resources are in communities that are being hardest hit. And those are communities of color, and we need to make sure trusted organizations like churches can be locations for that, trusted organizations like the ones that you work with. And as you mentioned, seniors, of course, whether they're nursing homes or other places, have been, of course, especially vulnerable, older Americans. And it's really important that we channel resources to those communities. And as we develop a vaccine, that same kind of information needs to inform the deployment of vaccines. They need to be deployed to those areas and people who are most at risk. I will also mention, Gary, that there are two major pieces of legislation that I'm sponsoring that would deal with this issue, both in terms of dealing with the health impacts from COVID, but also working to address the healthcare disparities. For example, in the area of maternal health, this is something that we've known about for some time, and we've been working on for some time.
But Senator, you've offered suggestions and recommendations that involves trying to fix our existing healthcare system. You've offered some policy recommendations that you have led to try and address the lessons of the past. Now, last week, I conducted an interview with Baroness Camilla Cavendish, who works for Boris Johnson, on reforms to the National Health Service in the UK. And I posed a question to her. What lessons can you offer us in the US that would allow us to ensure that we never go through this again? And what she said was, you have to fix your healthcare system. Because what happened in the UK, she said, was that we have a national system that provided universal access to the extent that nobody felt at any given time that they could not be tested and or they could not be treated. In Canada, they were able to kill the curve by virtue of their healthcare system and also the resilience and the discipline of their citizenry. Do you think this is a time for us to rethink how we think about healthcare at the national level to ensure that this never happens again? Is it the time for that conversation?
Oh, yes. In my view, the time for the conversation about reforming our national health system is way overdue. It predated the pandemic, but the pandemic has shown a harsher light on the disparities. And now there's this new urgency, I believe, to dealing with it. I should say, when it comes to this particular form of disease, pandemic, we need as a country to reestablish our defenses and early warning systems to begin with. As you know, this administration dismantled some of those early warning systems, both a special group in the White House, as well as some of our folks from CDC on the front lines in places like China. But the bigger issue, as you say, is dealing with the healthcare system overall. We are determined with respect to the pandemic to make sure that testing needs to be absolutely free here. That's in everybody's interest. And we need to make sure the vaccine is deployed in a manner that it can reach everybody and nobody doesn't get it because it's not affordable. So we need to do that in the short term. As to our system, yes. And look, one of our candidates, I'm just giving you the facts here. This is not a political discussion, but we know that Joe Biden has talked about creating a public option within the Affordable Care Act. Number one, we can't go backwards. So, rolling back any portion of the Affordable Care Act would be disastrous. We need to build on it. And in my view, we need to go beyond a public option toward building toward really universal coverage for everybody. And as you say, that's a priority if we want to make sure that every American has access to high quality.
So, Senator, if I'm a family in White Oak, Silver Spring, which you know very, very well, Lanham, Maryland, or Park Heights, Baltimore, and I hear the term public option, what does that mean?
Thank you for asking. What a public option means is that in where we have these healthcare exchanges that were established under the Affordable Care Act, under Obamacare, in many places, there are only one other provider or very few other providers. And what that means is it limits the choice of consumers, but it also increases the costs because of lack of competition. Yes. So what we would do is ensure that in these different healthcare exchanges, we have a Medicare-like option. It would be a government healthcare plan, and it would be there as an alternative to the private insurance plans, and it would create more competition and more choice. And so you don't have to take my word for it. The Nonpartisan Congressional Budget Office has said that will both save taxpayers money, but also consumers money by driving down the costs in the system. And we need to make sure that we drive down the cost of co-pays and co-insurance, because in addition to premiums, it's those out-of-pocket costs that are really hitting people hard. And so having a public option will allow people to have full coverage of benefits at a lower price.
Thank you, Senator. Can we switch gears slightly now to the economy? Because as you are acutely aware, the COVID-19 crisis has created our economy to a tremendous extent. We've seen families struggle, folks being furloughed, folks being laid off. But more recently, we've seen some very positive news in terms of the workforce issues around unemployment. Unemployment in the state of Maryland is around 7.2%. Nationally, it's around 7.9%. For African Americans, it's about 8.5% to 9%, but there is actually some movement there too. But the reality, Senator, is that what COVID-19 illustrated for many of us is that when many low-skilled, low-income people have jobs, frontline jobs, that deals with the public, they are exposed to the COVID virus more than any other group across the workforce. My issue with the $2 trillion CARES Act, which was passed back in March, was that of the $2 trillion, only 1.17% of those dollars appropriated went towards workforce retraining. What that tells me is that we had a unique opportunity to prepare our workforce for resilient jobs that would allow them to work from home or work remotely based on where we see the future of work headed, informed by technology and automation. Can you explain to me, and for the listening public, your position on workforce development for low-skilled and low-income individuals, but also to Americans who are 55 and over, who represent the largest single segment of our workforce by 2025. Can you please speak to that, please?
Yes, I share your concerns about the proportion of funds for workforce development in the CARES Act. What I would say, Gary, is, you know, the CARES Act was designed to provide emergency relief. As you just mentioned, we had millions and millions of Americans who lost their jobs because of the pandemic, and the immediate emergency was making sure that they would continue to have some kind of income to pay their bills, which is why the CARES Act included really probably the most important piece as a safety net, which was expanding eligibility for unemployment insurance to those who are contract workers and part-time workers and others who are not part of the traditional system, and adding the additional $600 a week in unemployment benefits. That was an urgent measure, along with the individual payments based on income eligibility and other matters. Now, all of that has, of course, expired, and we want to continue and extend a lot of that safety net in the HEROES Act that passed the House. The other part of this, as you say, is making sure that once we stabilize the economy, and it has improved, although 8% is still way, way too high in terms of unemployment, that we can get everybody into the workforce who's seeking a job. And that means this next round of help, in my view, has to focus not only on simply keeping our head above water for people who are out of work and need income replacement, but we need to get people back into the workforce, including, frankly, lots of Americans who were long-term unemployed even before the pandemic hit. That requires two things. One is workforce training. And as you mentioned, seniors are a very important part of this
Yes.
equation. I mean, that's what you work on. You know this. We have seniors who are much more active for a lot longer in their lives because of greater longevity. And we need to make sure that there are opportunities there. And I look forward to working with you on that. I will say that the HEROES Act 2 does substantially increase funds available for workforce training overall, as well as workforce training directed towards older Americans. And so let's look forward to working with you. Since we were unable to pass HEROES before the election, we'll work together on this as we move into the coming weeks.
Well, I'm pushing here, Senator, because what we have seen is, as you know, in our state, Baltimore was once one of America's great cities. It has been the victim of that period of deindustrialization, to the extent that its residents who moved out of the workforce because of a loss of manufacturing jobs did not have the necessary skills to re-engage in the workforce, and therefore it led to the demise of that once great city. The CARES Act dealt with a triage, was the fallout from the shutdown of the economy. It funded assistance to the states. It funded bailouts to small businesses through the Paycheck Protection Program. And as you mentioned, it also provided support for individuals who were unemployed. I think that was the period of time we could have thought not just about the triaging of where we were today, but how can we create a workforce that is able to be resilient to the major shocks that may occur when we have these pandemic. And my case in point is Germany. Germany in February of this year had an unemployment number of around 3%. In February of this year. In May, Germany's unemployment numbers was about 5% because it had a workforce that had the skills and the resiliency to work through a major shock to its system. Our unemployment numbers went from around 3.7% in March to around 22% in May. So I'm suggesting that we have to make a serious investment in workforce retraining for every American so that they can withstand any future shocks to the economy that may require us to work differently and remotely with greater dependency on technology. Is that a view you share?
Yes, I think this is an urgent matter. I will say, with respect to Germany's approach to the pandemic when it came to jobs and the economy, they took an approach which I think was preferred to ours, which is the government essentially helped pay the payroll share for many companies and businesses, which allowed them to keep on workers on payroll, even though they may not have been working because of the drop in demand. And whereas in the United States, we developed the Paycheck Protection Program, which certainly better than nothing, and it helped a lot of small businesses. First of all, was not adequately targeted to those most in need, but also created, it didn't as originally designed, encourage employers to keep employees on more than 60 days. I mean, it had some flawed things. So Germany took a different approach. But as you point out, Germany, even before the pandemic, has taken a much longer term view of workforce development, training, apprenticeship programs,
yes,
those kind of things. Those have to be at the heart of taking our economy from keeping our heads above water and just helping people who are out of work maintain, rent payments, to making sure people can be gainfully employed, as you say, in the 21st century economy. And so I think we need both direct funding of job training. We also need to give more businesses tax incentives for qualified apprenticeship programs. We need to make sure that our seniors have these opportunities. And finally, Gary, I will say, in addition to inputs on the workforce training side, we also have to provide incentives on the hiring and employer side.
Yes.
And I've introduced a bill again before the pandemic to deal with long-term unemployment, which I think is going to be, unfortunately, a chronic problem now because the economy is taking such a hard hit. And what that does is it provides for up to 2 years of subsidized employment for entities. They can be businesses, they can be agencies like yours, they can be nonprofits that hire people who are long-term unemployed, who've been trying to find work but can't find it through no fault of their own. And it would provide essentially subsidized employment and training dollars for those individuals, because we need both the push from job training and the skills building, but we also need the pull. We need the market to be reaching out to hire these individuals.
Senator, I appreciate that, but I have another question for you, which is very, very important for this audience. Black Lives Matter. George Floyd, Breonna Taylor, Sam DuBose, Philando Castile, Alton Sterling, Walter Scott, Tamir Rice, Michael Brown, Eric Garner, and Freddie Gray. I could have added more names, and I'm sure there will be more to come. The incidence of deaths among primarily Black male and Black female at the hands of the police departments across this country has created deep fears among the Black community. For many, it's a reminder of our nation's past. And it's also a symbol of our nation's unresolved problems around race that goes back 300 years. Can you share with the audience today your views on Black Lives Matter? And also, what can you tell the parent of a young Black child in White Oak, Lanham, and Park Heights, when they have to tell their little sons of how they must conduct themselves if they are ever stopped by a police officer? Could you respond to that, please?
Well, Gary, as I said, we are at a moment of reckoning in this country. And the question you ask goes to the heart of who we are as a country. And I do think you can draw a straight line from the evil of slavery to Jim Crow, to segregation, to systemic racism in many different forms, to what we've seen, these killings of Black men and, as you say, Black women at the hands of the police. And so this is, as you, going back to your quote that you began with, I do see this in many ways like the 1960s as a moment where we need to take the righteous demands for change in the streets and neighborhoods and bring that demand into the halls of Congress and the White House. And what I can say is we need to urgently come together to address this issue society-wide at every level of government and in every workplace and home and heart. Now, at the federal level, there are two things that we should be doing urgently. One, as I mentioned, is passing the George Floyd Justice and Policing Act. That is the work product from civil rights groups from around the country, those crying out in pain, and it would establish at the federal level, the national level, a set of accountability standards, transparency standards, barring outright certain conduct that we should never see from police or anybody else. And we have to pass that. Now, of course, to pass it, we need the votes in the Senate.
Yes.
The other part, Gary, I do want to mention, and I just want to emphasize again, is this other very important piece that of the legislation that I've introduced with Congresswoman Karen Bass, because police accountability is essential, but I think the issues go even deeper in terms of how we're organized as societies and communities to respond to these issues, where we have so many encounters with police that needlessly escalate and result in unjust deaths. And, you know, you just named all the people we need to remember. And as you said, there's so many more.
Yes.
But in so many of these cases, in all of these cases, this should not happen. Yes. These souls should be alive now. And if we organize ourselves better in terms of response, and so that we don't have a police law enforcement response to all these crises, whose roots are deal with much larger issues. That's number one. And third, and you're getting to this, then there are all the other deeper underlying issues that we need to address with. We can't criminalize poverty in this country. And we need to both decriminalize poverty, but also get people out of poverty. And so that is our challenge.
That's a good point. And then before I close, you know, I want to talk about civility. And you are an extraordinarily civil politician, a warm spirit. And as we think about civility, I think about the last 4 years. I think about the divisions we've seen in families, the divisions we've seen in communities, and the splintering of society, all of which has occurred over the last 4 years or more. But then I'm also optimistic. And my optimism is rooted in seeing these amazing young people come together over the last few months around this Black Lives Matter movement. Because their optimism, their drive, their determination, their hopeful spirit provides an example to all of us that we can all find and recapture our best selves. That gives me hope. Senator, in closing this segment of the interview, what gives you hope?
Well, Gary, I have the same sense of optimism. And the optimism you and I share was also shared by our good friend, somebody I worked with so closely over the years, the dearly departed John Lewis, Congressman John Lewis, who, as we know, put his life on the line in this struggle and for the right to vote. But when he saw young people in the streets and the power of the Black Lives Matter movement to bring people from all races and all generations behind that movement, he had an optimism, and I have that optimism too. And my view is American history, when we have moved forward and over that long trajectory, we of course have made progress. It's also a stark reality, as we're talking about today. We have a long way to go, but where we've made progress, there were two ingredients. One was active protest movements demanding change, like we see today.
Yes.
The other was legislators and others who are willing to translate that demand for change into changes in structure and law that provides more equal opportunity, equal justice. But that is what's on the ballot on Tuesday.
Yes.
That is what is on the ballot on Tuesday. And I think that we need to move forward on these matters urgently. And while you're right, we need Joe Biden, for example, has talked about restoring and repairing the soul of America and bringing people together. And we do need to bring the country together, but we need to make sure that we don't it's important that we come together, but we also have to move forward.
Yes.
We cannot allow compromise to result in stalemate. We need to be moving forward on these issues, and I am optimistic the country will take that path too.